Joining me now is infectious disease specialist, Dr. Isaac Bogoch. Doctor, thanks as always for joining us.
My pleasure.
Looking at some of those numbers, Ontario seems to be battling the biggest outbreak. Any indicators as to why?
Yeah, I mean, we know that this is primarily, not exclusively, located in southwestern Ontario, and it's among a largely unvaccinated cohort. And again, said with no stigma and no value judgment, but this is largely among a Mennonite community that has very, very low rates of vaccination clustered in southwestern Ontario. That doesn't mean no one else is at risk. Of course, anyone who's non-immune to this virus is at risk of getting this infection, and people who remain non-immune are those who are either unvaccinated. We assume people born before 1970 in Canada have been infected and recovered from this. So it's pretty much people born after 1970 who have not received the appropriate two-dose vaccine series.
Now, but we're also seeing some outbreaks, concerns about in Toronto at a concert and then out in Alberta as well.
100%, and that's exactly it. This is such a transmissible infection that it has a knack for finding and exploiting under-vaccinated communities and of course unvaccinated people, and this is an issue. We know that the rates of vaccinations have declined, and we don't really have that appropriate 95% vaccine rate across the country. Most people are, and most locations are, but there certainly are pockets that are not. And when the virus finds those pockets, it will have the ability to have subsequent chains of transmission just because it is so transmissible.
Okay, Dr. Bogoch, thank you as always for joining us.